Dear colleagues, it's a big honor to take part in this conference on children and adolescents' mental health devoted to the memory of Dr. Konstantin Danielian. Today, clinicians demonstrate huge interest to attention deficit hyperactivity disorder. The clinical picture of ADHD is composed by intense motor activity, lack of attention, impulsivity that in children population leads to poor learning, behavioral and social problems. It should be differentiated from a range of conditions where some symptoms may look like, such as personal specification of temperament, anxiety, neurotic reactions, cerebral asthenic symptoms in somatic conditions, side effects of treatment with some medication, autistic spectrum disorder, developmental disorder, and so on. ADHD can coexist with the mentioned conditions, thus attracting the attention of parents, teachers, and specialists, while ADHD itself can sometimes drop out of that attention. ADHD is a polymorphic clinical syndrome, the main manifestation of which is the child's inability to control and regulate their behavior, which results in motor hyperactivity, impaired attention, and impulsivity, as it mentioned. Especially the word polymorphic should be emphasized because in reality, no two children with ADHD are the same. This syndrome has many faces and actually a wide range of possible manifestations. This is a psychiatric disorder. Its cause, contrary to popular myths, is the peculiarities of the structure and functioning of the brain, and not poor education and other causes. The real reason is either genetic factor or perinatal damage to the central nervous system. That is why ADHD is a developmental disorder. According to the Centers for Disease Control and Prevention, the number of children with ADHD is pretty significant and estimated around 9.8%, considering the data from 2016 to 2019, including 2% among children from 3 to 5 years old, 10% among children from 6 to 11 years old, and 13% among adolescents from 12 to 17 years old. Boys are more likely to be diagnosed with ADHD than girls. Another study by the NCBI reveals that the prevalence of persistent adult ADHD was 2.58% and that of symptomatic adult ADHD was 6.76% in 2020. Children with ADHD have difficulties in learning, behavior, and emotional issues, and generally the problem has social significance either. Young, Moss, and their colleagues generalized data from 61 studies and found that they observed ADHD prevalence in prison population in 42 studies was 21.3%. These numbers speak on themselves and how important timely provided intervention for prevention of future complications is. Our colleagues from the US, Canada might have fresher numbers. However, we lack statistics regarding many disorders, including ADHD in Armenia. Considering the clinical, pedagogical, psychological, social significance of attention deficit and hyperactivity disorder, a study has been organized to reveal the scope of the work that is carried out with ADHD in Armenia. For that aim, a study was conducted by an online questionnaire where 55 specialists responded. This slide shows that 16 of the responders were special educators, 17 were psychologists, 6 were special psychologists, 9 of them were social workers, 5 were speech therapists, and 2 had other professions. This one slide shows that 21 of the responders just worked as psychologists, 16 as special educators, 9 were social pedagogues, 5 speech therapists, and so on. This slide shows the year of experience the specialists had. On this slide, we see the location of the responders. So many of the responses are from the workers of the psychological pedagogical assessment center. Here we see that the responders were 17 of them were from Sunik, Mars, 10 were from Yerevan, 9 were from Armavir, 9 from Lori, 8 from Kotayk, and 1 from Gerarkunik and 1 from Shirak, Mars. And the next question was if they have worked with people with ADHD. About 90% of them said they did. If the persons with ADHD who they worked with had the diagnosis of ADHD, and 12 of the responders said yes, but 21 said no, and 22 said that not all of the person that they worked with. This slide shows the number of people they have worked with, and it is, as we see, is not small. If the people who they worked with had any coexisting disorders, 7 of the responders said that mostly had only ADHD, but 18 said that they had coexisting intellectual disability. 15 said that it coexisting with autistic spectrum disorder, 7 said with other behavioral disorders, 4 said with learning disabilities. So we were interested what kind of intervention methods are used by them. The methods and approaches are very, very different. 9 said that they use play. 11 said just attention concentration strategies. And we see other just techniques or methods that are very, very different. Even there was one response that they use just narrative therapy. It just used conversation. Only 3 of them said they use ABA or behavioral therapy. And if they worked with parents of these children, 34 of them said they worked and it was efficient. 13 said they worked but it was not efficient, and 8 of them said they didn't work. This slide shows what kind of complaints the parents or teachers of children with ADHD presented. 20 said that mainly the complaints were about that children don't listen, they don't obey. 28 of them said that complaints were about being naughty, disorderly. 34% just complained about poor attention. 13% said that thoughtless. 4 of them said that complaints were about ill-mannered. 40 just said about the complaints were about hyperactivity. And 8 of them said that they represented other complaints. The next question we were interested in was about if they had any special training on ADHD, and about half of the responders said they didn't, and only 32.7% said they had, but 18% said that they just started on their own. And most of the participants of the study said that they would like to have some additional training about ADHD. And another slide is about how long they have worked with people with ADHD to have results. And we see that they are very different, of course, as children with ADHD, and their abilities are very different. But again, this slide says that we do not have some systemic and organized approach of providing the sessions to these persons. And here, another slide that shows what kind of assessment tools are used by the specialists. And as you see, they are very different. Of course, here there is the ADHD rating scale, ADHD screening scale, just interview with parents. Two of them were based on psychiatrist diagnosis. And there are answers about using ICF, ICD, just school function assessment, and many different other methods of assessment. Just in conclusion, ADHD is a chronic lifelong disorder, and therefore assistance to children with ADHD should be based on the concept of long-term support of the family and the child throughout life. And the therapeutic model should be focused on the reducing the negative impact of the ADHD on the development of the child, overcoming and preventing secondary problems, and not on complete recovery, as the contemporary studies show. And 26 responses about other comments, again, were that were mentioning, and specifically 14 of them specifically mentioned that they want additional training on this topic. And we can just conclude that here the specialists really need more instruments about intervention and about assessment to work with people with ADHD, and to have some systematic approach of organizing the work with people with ADHD. Thank you for the attention.